Hello, everyone. You are all welcome. Omiti and V, you are welcome. Gladys, you are welcome. It's 7 o'clock. Today is going to be an amazing day for us. I'm not going to take your time too much. So good evening, everyone. We are still welcoming people in. Let's wait a little bit and see those who are going to join us. Today is going to be an amazing day. You are all welcome to my broadcast right today. So what are we going to look at today? We're going to be looking at making Edo State great again. Making Edo State great again. That's what we're going to be looking at today. So please grab your pen and paper and have your telephone by your side. If you need to call in, please do not hesitate to do so. The number is on screen. Just call in. Making Edo State great again. Edith, Bella, and family, you are welcome. Thank you so much for tuning in. Thank you so much for tuning in. Johnson Idausa, oh, you are welcome. Oh, wow, Johnson. Today you are early. The last time you were late. Oh, thank you so much for tuning in. Thank you. You are all welcome. Today we're going to look at making Edo State great again in terms of healthcare. In terms of Edo healthcare. But I really want this message to be driven home. And I'm just thinking, should I do it in Pidgin English or should I use Edo? That because of people watching us, I think the least I can go for is doing it in Pidgin English. But whichever way, I'm going to start off with correct English. Oh, Unstoppable Family, you are welcome. Unstoppable Family TV, you are welcome. Thank you for tuning in. Thank you for joining us. Thank you. Please do not forget to give me that big thumbs up. You know what to do, right? Thank you guys for tuning in. I really appreciate you coming. Yeah, this problem has been so heavy in my heart, and I said, no, I'm going to talk about it today. We need to talk about it, really. The healthcare system in Edo State is what I want to talk about, and it's what I want us to talk about. Please share me out, guys. If you're here, share me out. Let every Edo lovers, every Edo light, every Edo citizen, including Edo wives, Edo husband, let them all join us. Please let them all join us and make sure they tune in and then we all have it together. Yes. Okay. So, yeah, you are all welcome. You're all welcome. I was just checking my phone. I thought someone was trying to call in. But whichever way, yeah, thank you so much. Thank you, people, for joining. Thank you for tuning in. I really appreciate your coming in. You're all welcome. So as you can see, the topic is making Edo State great again. How do we make it great again? My part, my contribution, where I want to come in, where I want to make an impact is in terms of the healthcare. Ogbe Miriam, you are welcome. Gracious, great. Oh, wow. Wow, thank you so much for tuning in. Thank you, and well done for your advice from yesterday. Thank you so much. Thank you. Please, guys, do not forget to give me that big thumbs up. Yes, so, yeah, today, like I said, what we're going to look at is Edo State healthcare system. So many things have been going on. Vera Obaze, good evening. You are welcome. Thank you for tuning in. You're welcome. Thank you. Oh, Mama Uwa, you are there. Hi, how are you? A big thumbs up. Thank you so much for tuning in. Thank you for coming. So today, what we're going to be looking at is how to make Edo great again. I have not officially come out to say, oh, congratulations to our our amiable governor, but yes, I'm happy he won. And again, today, another good news. Thank God. I'm using this media to say congratulations to Joe Biden, the newly elected president for the USA. My house is like divided. My son is for Trump, and me and the daddy were for Biden. Today we won. So, oh, he's telling me that he's not for Trump anyway. Yeah, we've won. We are all for Biden, and Biden has won. So we are the winning team, just like we all supported Governor Obaseki. Yeah, one thing is for a governor or a president to win that position. Oh, Rachel Idausa, you are welcome. Junior Morris, you are welcome. So one thing is for one to vie for a post and for the person to win that position. And winning the position means, yes, ahead, a lot of tasks ahead of that person. According to the saying, said, uneasy lies the hairs that wears the crown. Now, I am sitting down here today to talk about the healthcare system in Edo State. And I'm happy Governor Nogega Setua Obaseki won that election. Now that he has won the election, are we going to leave him to it? No. How do we support him? We can support in various ways. Security is there, social services is there, different ways. They are all there. We all have to come in and make sure we support our governor in making that word, making Edo State great again, becomes a reality. Otherwise, it's possible you just say something by mouth, saying for saying sake, you make noise with it, and when there is no action alongside to back it up, then there is not going to be any result out of it. So in my own way, I am going to support Edo State Governor Baseki in terms of in the area of healthcare. So I don't know, you watching me, I don't know where you're going to come in from, where you want to support him. But all I know is we want to make Edo great again. Choose your way, choose where you want to support him. I am supporting him with regard with in the area of healthcare. Oh, Carlos, thank you so much. Tina Benson, thank you for coming. So I am contributing to making Edo great again in the area of healthcare. So I don't know, you watching me, I don't know where you want to come in. But if you feel like joining me, joining the team of Health Redeem, joining Ryan Daniels Foundation to make Edo great again, you are very welcome, because we have a lot of good plans for people of Edo State. So right, let's moving on, because we are more than 10 in the house. I'm just quickly going to give you a brief history. I'm going to read it to you. And before I do that, I really want to welcome all our new viewers. If this is your first time of viewing Health Redeem live stream, you're very welcome. And if you are not subscribed, if you're watching and you know you've been watching, you've been following Health Redeem, but still you've not yet subscribed, please make sure you subscribe and share me out. If you are a YouTuber, please share me out and let your community join us. They can join us from Facebook, from YouTube, because we are streaming live now straight to Facebook and also on YouTube at the same time. So people can watch from Facebook, people can watch from YouTube. So if this is your first time, please do subscribe and make sure you share with your loved ones. Share with your family, please. I'm inviting you, do it for Health Redeem, do it for Ryan Daniels. Fine. Now, before we start, there's something I want to say. It's like our practice policy. What is the practice policy of Health Redeem? The practice policy of Health Redeem, I'm going to explain it to you. Whatever information you get from here is to bring awareness, health awareness. It is only for health awareness purpose only. It is not for, oh, yeah, okay, Uwadion, thank you for letting me know. So he said it's not only YouTubers that can share. If you are watching me right now from wherever you're watching me, please make sure you share me out and let others come and join. Let people come and benefit. Let people come and share their views. Maybe, who knows, maybe someone has a very good idea, which we can add to the one we already have. Then we can together in oneness, in one accord, make Edo great again. As far as it is with regards to healthcare, I am very much interested. All my 10 fingers are up for healthcare, making an impact. Oh, Liam, Nancy, you're welcome. Pat Paul, you're welcome. Thank you for tuning in. So our policy, our practice policy states that whatever information you get from us here on this channel is only for health awareness purpose only. It is not meant to replace your medical doctor's report, or it is not meant to replace medical diagnosis or to replace your medical treatment. So if you have any medical concern, please do not hesitate. Contact your medical doctor. So I hope everyone knows That's our rules and regulation. That's our practice policy on this channel. Now, moving on, like I said, our returning subscribers, you know what to do. Share. Our viewers, if this is your first time, you can also share. Whether you are a YouTuber, you are not, you can also share. Now, moving forward and going straight into our topic of today, which is making Edo great again. And our topic today is Edo healthcare in focus. Edo healthcare in focus. So now, Edo healthcare in focus. What do you think? Is a question. What do you think? So now, Edo healthcare in focus is a very, very, very broad term. So this is what we are looking at today. Edo healthcare in focus. When we say Edo healthcare in focus, what are we talking about? What we are talking about is we are looking at the system, the way healthcare is being run presently in Edo State. I think last week there was a topic I put up when a lady had a baby on March 23rd early this year. A lady had a baby March 23rd early this year, 2020, but she lost that baby. And when she lost that baby, because she had the baby through cesarean section, she was being billed, and paying that bill, she couldn't. So it was like, oh my God, what do we do? How do we pay this bill? Because she couldn't pay the bill, UBTH have to keep her. I'm not just talking here. I get reliable information before coming up to talk, before coming out to speak publicly. So UBTH kept her for 6 months. She has been in the UBTH since, until last, was it last week or some, yeah, less than 2 weeks, they finally let her go home because different activists were coming in to contribute. And they were all talking about it. They went to court and everything. Yeah, come to look at it. In Edo State, I'm not talking about Nigeria generally now. In Edo State, I think everything is there on paper. Every system we have abroad is there also in Edo State. Like social services at the hospital. If you cannot pay your bill, you can go to the social services office and make them know that you are struggling in paying. And then what do? They will now look for a way to support you. Fine. But is that what's happening? No. Okay, that one is one problem. Then second problem is, from the little research we did in Edo State, the result that came back to me was so disturbing. That's the only word I could use, was so disturbing. What is the result? You find a lot of our people, we need good medical care. Sure, that's what we're going to talk about today. That's why I'm here. So what happened is that a lot of people, when they are sick, they don't know what to do. They don't know the right place to go to. So that makes it a very big problem for our people. Why? Because they are not aware. They don't know the importance of early diagnosis. They don't know. So that's why, oh, I've shared, oh, thank you so much for sharing me. Thank you so much, Uwaidionwe. Thank you so much. So many people don't know the importance of early diagnosis. Even if they know, they now think, oh, the money is not really there because healthcare is not cheap. To be sincere, abroad, healthcare is not cheap. But because we are abroad and we pay one way or the other, we don't understand it. Like, for example, I've lived in Holland I lived in Holland for a very long time. And what do we do? In order for you to be secured with regards to medical care and everything, you pay your health insurance every month. Every month. Before I left Holland, the health insurance we were paying was about 130 euro every month. That's what I pay. And once you clock 18, or if you have a child that clocks 18, that child will start paying that 130. And then you can go see the doctor, and then you can get your medication. Then later we will say healthcare is free. Healthcare is not free if you really look at it. Now, coming down to the UK, we think, oh, the NHS is paying everything. No. Once you are working here in the UK, you pay your NHS contribution in one way or the other. So we pay. In the real sense, healthcare is not cheap. But what makes it better in the Western world is that everyone is putting in that medical pot, that medical wallet. Let me call it medical wallet. So everyone is chipping in, even if it is 1 cent, £1, everyone is contributing. Because everyone is contributing, so the load becomes a little bit not heavy. Let me just use the word. So it will the medical care will not be a heavy task. So people like put money together and then they take care of it. So if you have a prescription, you go to NHS, they just give it to you. That is if you are on low income. If you are not on low income, there is what we call NHS prescription charges, which is £9.15 as at yesterday. So I don't know if it is going to change on Monday. As at yesterday, it was £9.15 per item on a prescription. So if you are on a certain income in the UK, and then you have a prescription which has about, maybe for example, you have citalopram, you have neprozen, you have omeprazole, that's 3 items, and you can have 4 items on a prescription. And then you have maybe one other item because you can take 4 per prescription. So that's £9.15 times 4. How much is that? The accountant in the house, please, you people should calculate that out. We are looking about 37.20, thereabout. That's what we're looking at. So that is your contribution depending on your income. It's only when you are on job seekers, when you are looking for a job, when your income does not meet that threshold, that's when you don't pay. So healthcare is not cheap. That is the truth. But now we want the same healthcare, we want the same services in Nigeria, so that woman that was head in UBTH, that kind of scenario or that kind of issue or that kind of ugly situation will not repeat itself. So how do we do that? That's why I have decided to come to this broadcast and said, look, we need to make Edo great again. What is your contribution? What do you think? And we all abroad, we know that, going to this roadside chemist to buy medication, it does not help. And if you look at it, looking at it back home, it is not their fault. Because one, it is expensive. That is the truth. Medical care is expensive. I've just explained that of abroad to you now. How we think we are not paying, but indirectly we are paying. Indirectly we are paying. So in this situation, how do we make Edo great again? How do we join Governor Obaseki to make Edo great again in terms of medical care, so that people will not be going to that roadside chemist to go and buy? Because many people in Benin City, from our research, they prefer to go and buy from the roadside chemist. And who are those on the roadside chemists? They are not well trained. I'm telling you. They are not. Though some of the chemists, you have pharmacists working there, but most of the chemists, they are patent medicine store. They are not pharmacy. They are not full chemists. When you say chemist, you mean chemists. They are not chemists. They are known as patent medicine store. So, what do you think we should do? Yeah. Please, if you have idea, I really want to make it interactive. Please, please, please. Call in, put your contribution. If you don't want to call in, put it on your chat here. I'll be able to read it and then I will talk. Please, I really want to hear from everyone viewing right now. I really want to hear your contribution. Please, I really want to hear your contribution. Really. Please, 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 I want to hear your contribution. Please. Share me out both on Facebook and all, please. Share me out. Share me out. Don't worry. I'm just trying to respond back to somebody. Yes. I'm just responding back. So, what do you guys think? What do you guys think? What do you guys think? What should we do? What do you guys think? How do we make Edo great again? How do we change the healthcare system in Edo State? How? We have a way, but we are waiting for you to contribute. Yeah, we have an idea that I'm going to throw on the floor. And if you support, okay, then you say yes. If it's a good one, then you let us know. If you think it's a good idea, what we're about doing, If you think it's a very good idea, let us know. Yes. Or should I repeat the topic? Are you guys hearing me? Please, if you are hearing me, just type yes. If you are hearing me. It's like nobody's responding. I don't know if you are hearing me or if you are not hearing me. Or if you don't understand the topic, let me put the topic back so that you can see it. Yeah. If you're hearing me, please type yes. If you're hearing me, please type yes. If you're hearing me, please type yes. Guys, please, if you're hearing me, type yes. Wow. Oh, yeah. Thank you so much. You guys are hearing me. Thank you so much. I like that. Sorry, just a quick one. I quickly just, I muted myself because I was, doing something. So, guys, yes, you're hearing me. And if it's an interesting topic, if it's an interesting topic and yes, it's an interesting topic, or yeah, click, just put love to show that you loved it. Yes, I like that thumbs up. Give me that thumbs up. Yes, I love that. If it's an interesting topic, if it's something that, yes, this really concerns Edo State, and if you are from Edo State, or if you're an Edo lover, you are an Edo wife, whoever, yeah, if you're an Edo light, give me that thumbs up. That thumbs up, yeah, to say yes, it's a good one. And I want you to ask questions, please. I want to answer questions. I want people to ask me questions. Ask me questions. Really, I'm ready because there is something there's something we are about to start. Oh, right on. Oh, Pat Paul said right on. Yeah, I can't just be talking because I want to get ideas today. I want to get ideas. Though we have an idea, you can see the logo on screen. That's Ryan Daniels Foundation, which is a new one. It's just newly started in Edo State. And you guys saw the way I explained the healthcare system in the UK. And in Holland, also the healthcare system. We pay health insurance. We pay health insurance, and people who cannot pay health insurance, the government have a way of supporting them. And how does the government support them? There's what they call social. Let me explain. Many people don't know. I'm so happy. When I got to the UK, there's something I observed. You can't come here to the UK and say and be proud and say I'm on government. No, government supporting you. That's nonsense, bullshit. You think, yeah, they are helping you. No. Let me tell you something. In Holland, health insurance, you pay it yourself. How do you pay it? The government gives you what we call out caring. When the government gives you out caring, assuming your out caring is 1,700, at the end of the month, just a moment, please, just a moment. So sorry for the break. So in Holland, there's something they call out. So in Holland, sorry for that. So in Holland, there's what they call out caring. When you get out caring, you crack out caring. Assuming your out caring is 1,800 or 1,600. And then don't forget, Azivo, your health insurance, Azivo. If it's not Azivo, it's the other one, but they must register you in one. Out of that, your 1,600, they will remove 130 euros, which is your contribution for your health insurance. So that 130 euros covers you and your children under 18. Once any of your children clocks 18, they have to start paying the 130 euro themselves. Oh, thank you, Lady G. Thank you for coming. So they will have to start paying the 130 euros themselves. So which means in Europe, you are actually paying for your health insurance without you knowing. And then you think, oh, in Europe, we don't pay for medical care. I just go to my doctor. The doctor will just write for me, and then I'll collect my... No, it is not like that. Now, moving down to the UK, if you're working, you have what we call more, you contribute money. There's your NHS contribution. You do it. You do your contribution through your NI number. You do your contribution. And then because these people are sincere, this contribution does not go to one man's wallet. It actually goes to a public wallet, which is transparent and everyone will see it. Fine. And again, if you are on a certain level of income, though you are still contributing, there is another way you still contribute, which means per every item on your NHS prescription, you pay £19.15 per every item. So if you have 2 items, you are going to be looking at £18.30. If you have 4 items, you're looking at £36.60 that you will pay for 4 items. So then what did the system in UK do? What did the government do again? The other system they do, if you are the type that is on a regular medication, you are on regular medication, every month you must get about 4, 5, 6 medication, and then they don't want you to be, they don't want you, they know it's difficult if you start paying down £9.50. They kind of have what they call medical certificate, a prepaid. That means you pay it. When you pay it, it's like your contribution. I think it's about 100 and something pounds for 3 months. So when you pay it, whenever you come to the pharmacy, they give you your medication and that is it. But directly or indirectly, you are paying. You understand? The only thing is, it's not as expensive. And then for those who are really big, the big guys who don't want to use the roadside or GP surgery or wherever, they have a place they go to, like our president, our what is it, president? Yes, president of Nigeria, like Buhari and their group. When they come, there is a place they call Harley Street in London. I tell you, Harley Street, to see a consultant there, you pay nothing less than £4.50. I'm talking from experience. I'm not just talking. Yeah. So everything I'm talking, there is a fact. I don't want to bring out receipt. I can show you. Consultation. First consultation is £4.50. Follow-up is £235. Some are even higher. So directly or indirectly, you're paying one way or the other, you pay for medical care. But now let's drive it down to Edo State. What should we do? What do you think we should do? We in diaspora, I really want people to support my program in making Edo great again in the area of healthcare. So what do you think we should do? I wish Nigeria would change one day. We will change. Oh, Rachel, that's I said £9.20. No, it's not £9.20, it's £9.15. I'm a pharmacy person. We charge £9.15 per item on a prescription. Yeah. So maybe the 5p you are putting on top, maybe you'll be giving them for free. It's £9.15 as at yesterday. Maybe today it has changed to £9.20, I don't know. But as at yesterday, I collected £9.15 per item. Yeah. So what do you think we should do? Yeah, we know, according to Mama Uwa, he said the leaders are the ones spoiling the country. Yes, we know they are the ones. But then, if you let them spoil it, if we continue to look at them, just start watching them do what they like, they will continue to do what they're doing. You understand? But then, if we take an action, we'll be able to stop it. For example, there's this godfatherism they are doing. When it came in the time of election, when Oshomole came out as the godfather of the godfathers, Edo State were able to unite and said, no, we don't want godfatherism anymore. No, we are not going to accept that. And really, we were able to tell him that it's not about godfatherism, it's about what you have in your manifesto. And so many people saw what Governor Obaseki has, and they all went for him. But what I'm saying here today is, we want to support Governor Obaseki. He has been re-elected. We still need to continue to support him. So in the area of healthcare, please, 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 that's what I'm looking at now. How do you think we can come in to make Edo great again, so that we will now, Edo State will now look like, half of England, or I mean half of UK. Let me say, like, even if we are not fully operating like the United Kingdom, then let us operate half. Yeah. So, okay, how do we take action if it doesn't come from or from the leaders? Oh, Mama, well, we can take actions. I will tell you. That's why this channel, that is why we are going, it's going to be weekly broadcast, making Edo great again. Weekly broadcast. How do we take action? I'm going to tell you now. We have our first action. First action that we have introduced in Edo State. What time is it now? Okay, now it's good. I want to say it now. The first action is we want to have the right healthcare professionals. You understand? We want to make sure that the fake healthcare professionals in Edo State, they are being fished out. Oh, was it? Okay, we have bad leaders. Yeah, we know we have bad leaders from Miti and V. Yeah. So how do we do that? We want to make sure we get it right. And how do we get it right? The only way we can get it right is when me and you come together and say no. Because when Oshomole said he was the Baba of Godfatherism, though people were able to unite and said no more Godfatherism, no more Godfatherism. And yes, he saw it. Godfatherism was trashed out. So now, if we want to say no to bad leadership, we can also do that. That's why I am fully in support of NSAS. So it's not only NSAS, it's not only end police brutality. It is also to end bad medical care. That is where my passion is, to end bad medical care. That is it. And I need every support I can get to make it a reality, for we to support our amiable governor, Obaseki, so that his time, his reign in these 4 years that he has been re-elected will be great, and Edo will actually be great again. Now, where do we start from? There is, in the UK here, there is a program, and that program is, it gives you awareness. Is if you are a healthcare worker, a healthcare support worker, if you are a healthcare support worker, you must be well trained. You must be well trained. Yes. I'm speaking from the research we did in Edo State now. So you must be well trained if you are a healthcare support worker here in the UK. So that is why I'm telling Johnson, don't worry. I'm telling you what the righteous man can do now. I'm telling you what the righteous man can do. Just a second. I'm going to tell you where the righteous man should start working from. Just a second, please. So now, what do we do? Where we are going to start from, we have very, very good doctors in Edo State. We have. I'm telling you, because I have a program I'm running in Benin. We have good medical doctors. We have good trained doctors, but we are lacking something. You see, the healthcare support workers, they need to be trained. They need to be monitored. They need to be controlled. Why did I say this? You will see a nursing assistant. They will tell you, look, I'm a qualified nurse. No. Anyway, it is good. They can say that. Yeah, they can say that. But what I'm saying is they are not well trained enough. So how did I confirm that? There was a program we took to Benin. That is, the program is being run here in the UK. There is a school here in the UK who train healthcare support workers. We entered in the contract with them, and in that contract, they are taking it to Edo State, which is going to start. Anyway, it has started from this November. People can actually do it online. They will want to do it face to face. So if you have anyone, you're listening to me, if you have anyone who is interested, they can come in. So now, what we did was the school here in the UK actually took the program to Benin, and then we made some. Yeah, I'm not here to run anybody down. We let some people try it. When they follow the program at the end, they have to do the exam. Sorry. So we took the program to Edo State. When we took the program to Edo State, shockingly, most of the people who took the exam, they all failed it. So because of that, I came, no, together with some other people, we came together and then we make sure we signed a contract with this school here in the UK for them to take the program to Edo State. Maybe if you're my friend on Facebook, you might have seen the flyer, Ryan Daniels Foundation. So there's a fully funded course which we have taken to Edo State right now for young adults who are from 16. As from 16 years, they can be part of it. Though there are criteria they have to meet to be part of this program. And how is this program? How is it being run? It's being run by me and you. So if you're watching me now and you support, you love this idea of going to train young people in the healthcare sector as good healthcare support workers, please, 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 I will want to appeal to you at the end of this program. Make sure you contact me and I will tell you how you can contribute, because sometimes when you go to work, you drink a cup of coffee, £3, €3. You can contribute it to Ryan Daniels and say, every month, I want to give Ryan Daniels £3 or €3 just to support that cause in Edo State. So like I said before, in the UK, I said they kind of have a medical wallet, which everybody throws in money. And that money is being used to run the medical system here. And we, in our own little way, we still contribute, subsidize it by paying our NI contribution. So we can do it. We can do it if we all come together. If you watch the newly concluded governorship election, those in diaspora were able to make an impact. We were able to make an impact, and we stood. And I think majority of us stood strongly behind Governor Obaseki, and our voice was heard, which is good. So also, if we, the Edos in diaspora, come together, we can still make Edo great again in the area of healthcare. So that's why I am saying this. One, let us begin to make sure we have good, well-trained doctor support workers, because we have good support work. We have good doctors. Really, I work with so many of them in Benin. They are good. They know what they are doing. Really, they know what the doctors know what they're doing. And when we have this Ryan Daniels Foundation, there might be people who cannot pay their hospital bill. There might be people who cannot pay their hospital bill. With your support, we will be able to subsidize so many things. You understand? So that one is for that. And then again, another thing again that I want to bring out here. The Ryan Daniels is there. We are training healthcare support workers. If you are interested, contact me or contact Uwaidionwe. She will tell you more in case maybe you have any of your loved ones that want to be registered in that college, that want to be trained as a healthcare support workers, because it will help them. One, it will bring awareness about diabetes. It will bring awareness about epilepsy, different medical conditions. And there's even another of our well-talented professional here in the UK. She's a language and speech and language therapist. Really, she is my mentor. I'm not going to lie to you. An Edo woman, speech and language therapy. She knows it. Is her, in fact, when you say the person knowing onions, the woman know her onions to that level. So these are people who want to make Edo great again, and these people need support. She might get other professionals like her. They want to go to Nigeria, go to Edo State to make it great again. They need your support. You understand? So that's for that. That's for Ryan Daniels Foundation. So now moving forward, going to the medical side, because I know I've been talking about the healthcare system, what we're going to do according to Johnson. How do we make it, or what do we do in order to support our leaders? We know we have bad leaders, but if we keep quiet, they continue to do the bad. But if we keep talking, they will change. That is why I so much love social media. If not for social media, I will not be interacting with you like this. Now, I've told you, support Ryan Daniels Foundation in training the healthcare support worker in Edo State, so that we will have good ones, so that we will be able to fight those roadside chemists. At least, if you come to the UK, when you see some healthcare assistants, you will think they are full BSc nursing, full BSc holder in nursing. You will think they are, because they are well trained. They know what they're doing. In fact, there's no pushover in UK when it comes to healthcare. If you are talking to a healthcare assistant, they will speak to you and say, yes, I know what I'm doing. If you're talking to a pharmacist, is he a doctor? Is he a nurse? Everyone is valued, and we all know what we are doing here in the UK. So that same thing, we can take it to Edo State with your support. We can do that. Now, moving on, because I'm not going to take too much of your time. Normally, I have 1 hour, and it's 1 hour I want to stay. I don't want to talk more than an hour, because every week is going to be 1 hour. So 1 hour with Health Redeem every Saturday. Please put it on your calendar. Now, the next one I want to talk about is early diagnosis. Please, 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 if you have your family back home, I want you to pass this message to them. Let them understand why they need to actually follow up on their medical care. Because one of the problem I keep seeing is, you see, almost everyone in the Edo State have been preaching, they say, oh, they have stomach ulcer. No, it's not stomach ulcer. It all boils down to lack of awareness. You see an elderly person, a man or a woman of about 65, 70 years, will be on NSAID as if he or she is on paracetamol. Why? Lack of awareness. Okay, now you tell them, go and do medical tests. Like blood tests. Let's go and do blood tests. Oh no, I never buy medicine. Now we can't see money where I go take do blood. I beg, just give me the medicine, make I drink am. Lack of awareness. You understand? And then another big problem, which I want to talk about again, is that many people don't know the difference between a primary care and a secondary care. Thank God, and I really want to use this medium to say thank you to our governor Obaseki. I don't know. Don't you people should not get me wrong. Not that I don't. It's not his person, but I love his ideas, his talent. I love that. Yes, I loved his talent. What he's got up there is very, very super. It's correct. You see, when he came to the UK, he told us that Edo Specialist Hospital is there, but it's going to be for referral. And you know, many people don't understand the meaning of referral. We need to understand. So please, if you're listening to me, make sure, if you understand the meaning of referral from what I'm going to explain now, make sure you explain to your people, let them know the meaning of medical referral. A hospital, when they say referral, let them know the difference between primary care and secondary care. Now, this is where we're going to start intervening again. In let me say Western world, Holland, Belgium, whatever, there is what we call house doctor, or in Holland we say house act. In UK we say GP surgery. These are places where you go to, you meet with a general doctor. What we mean general doctor, there's no particular area they will say, oh, I am a specialist. Maybe they are, but they are working there as a general practitioner. So a little bit of this, of this, of this, of this. And then when you go to them, they'll be able to tell you this is what they think is wrong. And if they think that, oh, from the eye problem you brought to them, they can't do it, they will refer you now to a secondary care, which is ESH, which is Edo Specialist Hospital. You understand? So your GP or your house art is your number one point of call. You can't just go and say you are going to the big hospital. Like in Holland, we say Western Ziekenhuis. No. Like in the UK, we say Whittington or Homerton Hospital. No. You can't just go there. First, your GP have to refer you. And when your GP refer you, that's your house doctor now, refer you to the main hospital. Then you can go to the main hospital. And when you go to the main hospital, it is there you meet with a specialist. You meet with a surgeon, a consultant. You meet with those big names. You understand? It is there you meet with them. Yeah. So now, in my next broadcast, which is next week, I really want to explain the difference between a primary care and a secondary care. And when more people come and start viewing, following us on YouTube like this, they will also get awareness. They will now see the importance of going to do that blood test. And if you are watching me, I want to give you a takeaway. If you have your loved ones and they say they are not well, ask them, have you done a blood test? And if they say yes, tell them bring the result. Me that I'm talking to you now, if you want someone to read it, I'm not going to charge you if you are part of our, our family. I won't charge you. Join Ryan Daniels Foundation. I won't charge you. If they give you blood result, you don't see who read it, I will help you. Bring it. I'll look at that laboratory result and I'll tell you. Because here abroad, before you give an elderly person NSAID, they want to see the kidney function, the functionality. Is the kidney able to filter the medication out of the body? Is the liver fit enough to process the medication? They don't just give. But this is one problem we are finding in Nigeria or in Edo State. And that's why me and you must come together and see how we can do it. And I'm really using this first broadcast as a wake-up call. I'm calling on all of you to please support Ryan Daniels Foundation, support me, and let us make sure we change Edo State, please. And I really want everyone here watching, please, I want you to be interested in the healthcare of Edo State. Let us change it. As we were able to tell Oshomole no go for that reason, let us tell our fake, I've not met with a fake doctor anyway in Edo State, because the doctors I've worked with presently in Edo State, they are all super. They are good. Yeah, like one of my work colleagues will say, gooder. They are gooder. You understand? They are very good. So I know we have good doctors there. But what I want us to fight against are those small roadside. And we can't fight them because some of them will say they are looking for what to eat. Like one of my video, I don't know if you've not watched it, go and watch it. One woman was selling medicine in the market, and then someone else asked her, madam, what did they say that medicine? Madam, you be pharmacist? He saying learn and small. That thing, it shocked me. Then they learn pharmacy small. Pharmacy that you will use 4 or 5 years to learn. Now one woman carry the medicine for her. They saying learn and small. He saying fair give and 6. He not do. Can't give and 16. Make it chop and join her. You see? So those things we need to put an end to it, really. We need to put an end to it. We need to put an end to it, but I cannot do it alone. I need your support. Ryan Daniels need your support. Please. I really want you to contribute. And it is very easy. You can easily join us. You can easily help us. You can easily join the bandwagon of making Edo great again in the area of healthcare. Really, we really need to make Edo great again when it comes to Edo healthcare. We are talking about Edo State healthcare now. Let us change it so that we start sending money for burial. People stop dying on timely death. It is not good. No, it is not good. People are dying on timely death. And then you see people are falling sick. We need to do something about this. We really need to do something about it. Yes. So please, if you're watching me and if you've watched me this evening and you know you have a contribution, there's something you want to tell me to add to it, you have an idea, please do not hesitate to let me know. Lady G TV, you are welcome. Thank you for tuning in. So please, I really appreciate it if you all can just leave me a comment on YouTube and tell me what you think, what's your idea, and I will look into it. Because there's something, my goal is I really want to bring up something that is preaching, campaigning in Edo State about early diagnosis. Yes. And I'm ready to train as many people as I can. The school is already there. Ryan Daniels Foundation. Next time I'm going to put the website address here. You can go check it out, or maybe I can do it now. You can go check it out. I'm going to put the website address right now. So you can go check the website out. It's there. Just let me put it, Ryan Daniels. Sorry, I'm just typing it out. Ryan Daniels Foundation.org. So, oh no, I have to put X. I'm trying to. My glasses is not here, but I'm able to do it. Okay, Ryan Daniels. No. Yeah. Oh no, let me do it again. Sorry about that. Okay. So, .org. So that's the website. Please go and have a look at it, and then go and have a look at it. Visit the website, and if you have any question, please do not hesitate. Contact me. It's Ryan Daniels Foundation. I really want to make sure we change Edo State in the area of healthcare. I want to contribute, and I want you watching me to join me to contribute in making Edo great again. And again, for you to know that God has really said it is time to make Edo great again. The school here in the UK, they signed a contract and said, yes, they are ready to train as many people as we bring. So if we like, bring the whole of Edo State, they are ready. And then we have a building, we have an educational center in Edo State. It's on if you are very familiar with secondary secular by Virginia, the school is there. It's a very big building. The promotional material, everything will be out very soon. So the registration is open. Please let us come together and make Edo State great again in the area of healthcare. If you are for security and you want me to support you, I'll be there to support you. Please, let's really come together and make Edo State great again. Let us change the face of Edo State healthcare. Let's make Edo an enviable state that people will say, oh, how I wish I am from Edo State. How I wish I am from Edo State. Please, please, please. And if you have an idea that I have not touched on this evening, do not hesitate to let me have it. Just leave it in the comment box for me. I will actually look. I will surely look into it, and I will respond back to you if there's any question. So please, please, please give the information you've heard here today. Give it out. Let your people see. Just a second. I think. Oh wow. Okay. So that is it. We still got, how many minutes do I have to go? I still have about 2 minutes, 3 minutes to go. That's fine. Yeah, so like I said, it's just going to be for 1 hour. I'm not going to take your time. Oh, so yeah, so it's all right. And yeah, like I said, everything will be fine. We want to make Edo great again. If you are interested, please do join me. I've got a minute to go. Thank you all so much for tuning in. I won't be taking more than 1 hour of your time. I really want to keep to the time. 1 hour is 1 hour. If I didn't say there's anything I forgot to touch on today, next one I will touch on it. And then just a quick one, please. Or someone was telling me that it's better if I do this program in Pidgin English so that I'll be able to carry everybody along. So if you are supporting for Pidgin English, quick, type yes. If you support Pidgin English, type yes. Give me that, you know that, what's it called? Emoji. Give me the emoji. For if you want Pidgin English, make we dey knack the matter well for Pidgin English. Oh yeah, please. If you're here, give me the emoji. If you love Pidgin English, just give me love. Put the emoji love. So quick, let everybody answer now, because I can see the number of people watching me now. Yes, but I want to get that emoji. If you prefer it in Pidgin English, put the emoji and say you love it and let me count. Majority wins the vote. If you love if you love it in Pidgin English, make we dey knack the matter well for Pidgin English so that our mama and papa, as I dey live, so our dede and our papa, dem go dey hear wetin I dey talk. Not be everything you go say, which English you talk there. Even if you want it in Benin, leave a comment for me. They were when year dota, yeah, I'm a proud Edo medical healthcare professional. I'm proud Edo. So if you want me to use Edo to say it, I'm ready. Yeah. Yes, 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 yes. If you want Edo or Pidgin English, oh yeah, choose. Which one do you guys want? Edo or Pidgin English? Leave your comment for me. Leave your comment for me. So thank you guys. It's 1 hour 25 seconds now. And I'm going to go now, like I said, 1 hour on the dot. Anyone is fine, Lady G. Okay. If you say anyone is fine, it's all right. But I think now the Pidgin English or na Edo, I don't know the one way be say, like I watched one video. Let me say something. Sorry, I just going to take about a minute or two now from you. I watched a video yesterday. I wasn't so happy when one guy came on Facebook and said, Benin people, they can do anyhow. All these Benin guests, blah, blah, blah. He was just talking anyhow. Please, I don't know who that guy is, but point of correction, I'm a born proud Edo lady. Born proud Edo woman, born proud Edo one, and a well-educated woman. And it's not every Edo that goes out to the social media and start fooling themselves around. No, it's not all Edo ladies or Edo women or Edo females that go about. I tell you, one of my brother-in-law, he is a medical doctor, young guy, pure Bini, mama Bini, papa Bini, Iviedo, live and direct. So is social media. And you need to know where these people are all coming from. Or understand? It's the background of people you look at. And is a correct Bini now be. Correct Bini. You understand? Correct Edo. So yes, so it's 1 hour, 2 minutes now. You guys, thank you so much. Thank you for tuning in. I'm going to end the live streaming now. Thank you, and I'll see you next week. So please do not forget to leave me a comment. If there's anything you want me to say that I didn't say today, leave a comment for me. And if you enjoy today's one, if you enjoy it, please, I want to hear from you. Thank you so much. See you next week. Bye.